Vitro Fertilization, IVF, is an assisted reproductive technology that involves the fertilization of an egg by sperm outside the body. The process of IVF typically involves several steps, including ovarian stimulation. The woman undergoes hormonal therapy to stimulate the ovaries to produce multiple mature eggs instead of the usual single egg that is released naturally each month. This involves daily injections of fertility medications to stimulate follicle development. Monitoring and ultrasound. During ovarian stimulation, regular monitoring is done to track the growth and development of follicles through transvaginal ultrasound scans. Blood tests may also be conducted to measure hormone levels. Egg retrieval. Once the follicles have reached an appropriate size, a minor surgical procedure known as egg retrieval or follicular aspiration is performed. It is usually done under sedation or anesthesia. Using ultrasound guidance, a needle is inserted into each follicle, and the eggs are aspirated. Sperm collection. On the day of the egg retrieval, the male partner provides a semen sample. If needed, donor sperm can be used instead. Fertilization. The retrieved eggs are then fertilized in the laboratory. In traditional IVF, the eggs are mixed with sperm in a culture dish and left for several hours or overnight to allow fertilization to occur naturally. In some cases, intracytoplasmic sperm injection, ICSI, may be used, where a single sperm is directly injected into each mature egg. Embryo development. The fertilized eggs, now called embryos, are monitored in the laboratory for several days to allow them to develop. The embryos are usually cultured in a special medium, and their development is assessed. Embryo transfer. After the embryos have reached a certain stage of development, one or more embryos are selected for transfer into the woman's uterus. This procedure is usually performed without anesthesia through the cervix into the uterus, and the selected embryos are transferred into the uterine cavity. Embryo freezing. Optional. Any additional high-quality embryos that are not transferred can be frozen, cryopreserved, for future use. Pregnancy test. About 2 weeks after the embryo transfer, a blood test is performed to determine if pregnancy has occurred. It's important to note that the specific protocols and procedures can vary based on individual circumstances and the practices of the fertility clinic. The success rates of IVF can also vary depending on factors such as the woman's age, the quality of eggs and sperm, and the overall health of the couple. It is recommended to consult with a fertility specialist or reproductive endocrinologist who can provide detailed information and guidance.